All right. Good afternoon, everyone. Welcome to the 2024-25 PIAG Health Insurance Open Enrollment Kickoff Meeting. My name is John Kruger. I'm the president for PIAG. Going to turn things over to Heather Bruta here in just a minute to walk through the plan options for next year. But just wanted to briefly say before we got started, just a quick thank you for everyone who is on the call, who has their health insurance through the PIAG program. Obviously, this is a big value for your employees. It's obviously a big benefit, an important program for your company. So we do appreciate your business and your trust. Hopefully, we'll be able to maintain that next year moving forward based on what you see here. And for anyone who's online or on the webinar who's doing a little shopping, maybe looking at options for next year, who we aren't currently working with, I hope you like what you see something interesting, and hopefully we can work with you moving forward too. So with that said, I'm going to turn things over to Heather and Evie, and they're going to walk you through the health insurance options for next year.
Hi, everyone. My name is Heather. I'm the account manager. At some point, I've probably spoken to you or emailed you. I also have Evie on the line. She's the director of PBIT. She's here to assist and review Imagine 360 and our PBIT plans and how they work. So we can get started. So we have our Kaiser Permanente plan, which is our HMO plans, and then we have our Freedom plan, which are our PPO plans, and we have several options within those two groups. For anybody who doesn't know what an HMO is, it kind of works like a gatekeeper. You have somebody who you have to go within the network unless it's an emergency situation. You have a provider that coordinates all of your healthcare. And we have that with Kaiser Permanente. Kaiser Permanente, we had an average of a 5.3% increase this year. And we also had some migrations, but from what I can see, the plans actually look better than they did last year for Kaiser. We also have one additional plan change that's kind of like a catastrophic plan for maybe somebody young, healthy, or somebody who just wants to keep it at a low cost and still have insurance for catastrophic stuff. So this is the plan that we used to have that will be expiring on 11/30. So the new plans that are in red, which is the KPD HMO plan 500, will be starting 12/1. So the changes are the older plan did not have a deductible. The new plan has a $500 deductible. And then the out-of-pocket is considerably better. The out-of-pocket on the 50-55 plan, which is one of our most popular plans, was the $6,350. And now it's the $3,000 max out-of-pocket. Also, the doctor's office visits went down. They went from $50 for a primary to $20 for a primary and $30 for a specialist. Urgent care also went from 50 to 40. And the mental health went from $50 to $20. Hospital admission is a little different. It was $1,500 per admittance, and now it's 20% after deductible. So that would be the $500 deductible. Chiropractor is now covered at $30 where it was $55, and vision deductible is now $20 where it was $50. We're still going to have frames and lens and vision office visits. Prescription drugs, there used to be a deductible and now there's none. Also, the 30-day supply on medication, those deductibles or the copays went down, as well as the 90-day. As you can see, it used to be 30, now it's 15 for generic, and so on. The next plan was our KP deductible HMO 2000, and it used to be no co-insurance. Now it's a 20%, so it's 80-20 split. The deductible was $2,000, now it's $1,000. The max out of pocket used to be $4,500, now it's $3,500. As you can see, the primary care office visits also went down to 25.35, as well as urgent care, which is 50. And mental health is 25, where it used to be 30. Okay, and then as well as the deductible is, we don't have a deductible for RX anymore on the plan, and the copays are, or the copay is now 15, 30, 45. So that went down just a tad bit. And again, this is the Kaiser Permanente HMO 2000, and the migration will be for 12/1. So if you decide not to move, you'll just automatically be migrated into these new plans. And then here's the this is the new plan that the HMO, the catastrophic plan I was talking about. This is a completely new plan. Like I said, this may be for somebody who is young, healthy, really can't afford any of the other options. This is a good option. So it's a $3,000 deductible, $6,500 max out of pocket. You do get 3 primary care visits at $40, and then everything else is subject to deductible. So if anybody's interested, I can go into detail more about this plan. So now we'll go into the Freedom plans. We had an average of a 5.8% increase. The way a PPO plan is, it's different than an HMO. You don't have to have a referral. You can go in and out of network. There could be balance billing if you go out of network, but at least you have the option to do that. So these plans changed a little bit, very, very small amounts. For the 35/12/50 plan, it's now $35 for an office visit and 40 for a specialist, where it used to be just 35 for both. So it's just an extra $5 just on the specialist. And then also the deductible for hospitalization went from 10% to 15%. And all the changes are highlighted in pink. So the PBT Freedom 40/17/50 is now going to the 45/17/50. Deductible stayed the same. It's just the office visit went from $45 copay for a primary and 50 for a specialist, as well as the RX changed from the 15/30/45 to the 20/40/55. So those are your brand and your specialty prescriptions. The 45/32/50, again, the only thing that changed on that would be the $50 specialist, where it used to be 45, and then the RX changed as well on that. This is the 55/5500 plan. So the office visit went from 55 to 60. Where the specialist used to be $55, it's now $65. And a changes again with the RX to 20/40, the same as 50% for specialty. And then the HSA, the only thing that changed on the HSA, because HSAs don't have co-pays, everything is subject to the deductible other than your physicals. The only thing that changed on that would be the RX program. And I should have said that before. All your preventative services are not subject to office visits. So your well woman, your annual physical, your lab work that's affiliated with your physical is all covered at 100% when you get older, mammograms and also colonoscopies. So I'm going to hand this over to Evie, and we thought maybe we would show an example if somebody was submitting a claim. So this is before the claim, but so when you're first, say you have to get a surgery or something. So Evie, I'll hand that over to you.
All right. Well, hello everyone. And sorry, my camera is flickering, and so that's why I shut it off. David, it's always nice seeing you. So great. All right. So there is the way that this particular plan with them, although the Freedom plans pretty much are considered commercial PPOs. And I say that because sometimes when you go to a doctor and they see the ID card, and the eyebrows may be frowned because it's thinking, wait a minute, this is not a kind of a usual name. Just you can always mention it's commercial PPO. So what happens with claims? There's some people that pay upfront sometimes. and what you do, and then you submit that claim with proof of payment. And then Imagine 360 processes that, reimburses you less applicable copays. The one thing to keep in mind is that the claim that you submit needs to have very detailed information so that you don't have any delays. Provider information, name, address, tax ID, date of the service, the name of the patient, procedure and diagnosis codes. As long as all that information is in your claim, you just submit it. You can submit it directly to Imagine 360, or you can send it to us, and we're happy to submit it on your behalf. You allow 30 to 45 business days for this claim to process, and then you will be reimbursed less any applicable copay. And that is the way to process claims. Now, when if there's a claim that you don't pay anything up front, you get the bill from the provider, you just submit it. It's important to have that itemized type of bill that has all the details: the provider name, address, tax ID, procedure, diagnosis codes, total charges, patient, date of service, and then Imagine 360 processes that claim, pays the provider. Every time a claim is generated, an explanation of benefits follows. So it's very important when you do not pay up front that when you receive that EOB, explanation of benefit, eventually you will get a bill from the provider saying, okay, now you, Mr. Patient, you owe us this, Mr. or Mrs. Patient, you owe us this much. Make sure you compare your EOB to that claim, because you should never pay more than what that explanation of benefit indicates under the patient responsibility portion. And I mentioned before, if the claim from the provider ever says that you owe less than what the explanation of benefit indicates, absolutely you're welcome to pay the less amount to the provider, and that's it. But you never, ever, ever pay more than what your explanation of benefit indicates. Okay, so always remember, you get those. If you have not registered on the portal, I highly recommend you do. Is very simple. When you register on the My Benefits portal, you can view all your EOBs. You can do all kinds of things for search providers. You can get your benefits. You can print an ID card or order an ID card. There's a lot of, it's a very useful tool, and I really, really recommend that everybody registers on the My Benefits portal. As far as pre-authorized needs, if you ever have a hospitalization or a procedure that needs to be done, it's a very good idea to have it pre-authorized so that you don't have any issues with that. So that is something that also Imagine 360 assists with. Okay. So you have different type of service assistance, disease management, excuse me, health management and wellness, utilization management, pharmacy management. There's all kinds of assistance and resources you have available to you. Member guidance. So yeah, the very again, recommend, this is just kind of a little bit of a snapshot. When you go into the portal and you register and you do a provider search, it gives you information as to, the quality of service, the price idea. So definitely encourage you to register and be able to see this. Okay, how to find a provider. So there's two ways. If you decide not to register for whatever reason, you can search for it going this route. But when you register on the portal, you can just go in there and do a provider search. But if you decide to go this route, you just go to that link that you see on item number 1. You click find a provider. You make sure that the multi-plan is the network that you log in. And you want to make sure that you log in that practitioner and ancillary, and you do the search. You can do the search by name of the provider, or you can do the search by the location of the provider. And then you can either also have options to do other kind of specifications, whether it be a gender preference on the doctor, what have you. You have all those options. So this is the way. This is a little bit of a longer way. But if you go into the portal, because you're already registered, you just go on to find a provider, and you can do it that way as well. UCM. So this is the This logo is on your ID card, and it's virtual care, 24/7. Anything you need, you ran out of a prescription, you talk to a doctor, and you let them know what your prescription is. They can call your prescription to the nearest pharmacy. You have anything that is not an emergency, you talk to the doctor about what that need is, and they provide you digital virtual care. So take advantage of that if you have not, 24/7, anywhere you're at. Okay, who is Imagine 360? So Imagine 360 is a TPA, third party benefit administrator. They are the ones who process and pay the claims. They are your member service advocate. There's so many different layers. So they're the member services. They provide portal information for you to be able to do a bunch of different things. And they are who you want to call whenever you have any issues, whether it be a provider issue, a care issue, a balance bill issue. If you have a situation where you have paid your portion and you continue to get billed after the from by the provider, just make sure that you always submit that balance bill to this email that you see at the bottom here, balance bill, and they will take care of it for you. Because again, remember, you are never responsible for anything more than what the explanation of benefits indicates. And anytime you have a balance bill issue, do not hesitate. You are welcome to send it directly to this balance bill team, or you can send it to us and we can forward it on your behalf. And an advocate will be in contact with you, letting you know the process on how this will be resolved. All right, questions that come up, and my doctor or provider say they won't accept the insurance. A lot of doctors, what I've found in my experience is they just need to be educated on what plan this is. So I have several experiences with members where they have this, and all I do, I just call the provider's office. I let them know this is a commercial plan. It behaves just like a PPO. All you need to do is submit your claim. I show them where the claims address is on the back of the ID card, and the claim will be paid accordingly. One of the things I do mention to the doctors, do you currently see Medicare patients? Oh, absolutely. It works just exactly the same. All you have to do is just see your patient, take care of that, submit your claim, you'll be paid. There's no other issues. There are times when I even do a three-way conference call between the provider and Imagine 360, so they can get uh, all the information they need as far as benefits and eligibility. Once they get this and they're comfortable, then they're fine and they submit the claim, they get paid, and the rest is smooth sailing. I can't find a facility, hospital in the network. So this plan, there is no hospital, how can I say, there's no network for hospitals. So all you do is basically get seen by the provider, wherever the provider, if they need to do surgery or an outpatient procedure, they they do it wherever they need to do it. The claim is submitted and the claim will be paid accordingly. So just never be discouraged if you ever get this, oh no, we don't take patients with this plan. Never, just call. I always encourage providers, call the provider line on the back of the ID card. If they refuse to do so, then you let us know. We'll call the provider for you, educate them, and then do the three-way call if needed be. But yeah, never be discouraged as to, no, my plan is not working or it doesn't work. It does work. It's just a little bit of smoothing out at times. Okay. Let me see. I have not received my ID card yet. Okay. So if you don't have an ID card or need another one, again, if you're registered, you can just go on the portal and order another, or you can call member services at Imagine 360 and have another ordered, or you can email us and we'll be happy to get another one ordered for you. The only thing we need to double check is make sure that we have your current home address on file to make sure that it's being sent to the proper address. Okay. And if any of you have not seen this resource sheet, it's a really good idea to get one. It shows you the different layers from Imagine 360 Member Services, what they do, UCM, which we went over, virtual care, and the phone number to call, KISS imaging. If any of you have noticed, your ID card has this logo as well. KISS imaging is there for you to help you find heavily discounted facilities where you can get an MRI, a CT scan, and just get either paid nothing or very little out of pocket. So you just call them and let them know what you need, and they will help you find a location near you. So be aware of that in case that ever comes up with you if you have one of those orders.
And this is also in the yearbook, right, Evie?
Mm.
This is,
No, it's not. That's just a separate sheet.
okay, all right. If anybody needs this, I'll send them a copy.
Yeah. Yes, yes, yes.
So
Hey,
if
Heather?
anybody, yes,
Before we go forward, Evie, there was a question for you in the chat. So the question is, does the insured need to turn in all the claims now instead of having the doctor's offices do that?
It's better if the doctor's office submits that claim to Imagine 360 because they have that what they call the super bill or the itemized bill that Imagine 360 needs to see with all the details. So it's best if the provider submits the claim, but if for any reason the provider just refuses to do so for whatever reason, they're welcome to send it to us and then we will submit them on their behalf. But it's always best, we always recommend providers to submit it because they provide the super bill with all the details.
was there another question, Jenny, that?
Nope, that was it. Thank you.
Oh, okay. So if anybody's aging out or needs help with any kind of Medicare information, you can contact Becky. And if you can't get a hold of this information, just email me. I can send it over to you. Dental, vision, dental, and life. So dental and vision got approximately a 2 or 3% rate increase. All the plans have stayed the same. We have, high plan Delta Dental, low plan, and then we have what we call a schedule reimbursement plan, which is our least expensive, which is a very good plan. It's covers for most of all your preventative services. And then there's a fee for which they'll pay for crowns or endodontics or something like that. If you're interested in, if you don't have dental and you're interested in moving to that plan, I have the schedule I can share with you, or if you're the other plans, for whatever reason you don't like them, then we can move you over at open enrollment. The basic life rate stayed the same, so nothing, no changes there. What I would like to say about the basic life is what I saw happen a lot last year. When employees are hired, a lot of times people forget to add them to the life insurance because they probably don't want the dental or medical. So just be mindful of that we get that, because if not, then we can't add them. Is that right, Evie? If they don't come on within the waiting period, we can't add them, or they have
Yes,
to.
that's very important point. So whenever a new hire is eligible, it's best to go ahead and just put the enrollment for the life insurance because they cannot do that at open enrollment. They will
Yeah.
think probably, okay, maybe something went wrong. That's why they want to enroll now. So yeah, it's best to do it at their original eligibility date.
So here, it's just, Delta and Humana, the Delta and Humana plans, we have the PPO plans. Like I said, the high and low plan, and then, this is that schedule plan with Delta Care. There's also one, with Humana, which is the EPO, right? The EPO for,
PPO, yeah, we have PPOs with
yeah.
Humana and
Like I
Delta.
said, these are less expensive, but you do have to choose a primary care dentist.
Yes.
And everybody that I know is on this plan is very happy with it. And like I said, the rates are very inexpensive. And you want to talk about this, Evie, a little bit about
Sure,
supplemental
sure.
life? Okay.
Yeah, there's no benefit changes with Symetra, as Heather mentioned earlier, as far as the basic term life insurance, the same with the voluntary term life insurance. Keep in mind the guaranteed issued for new hires. When they are newly hired, they can get up to $120,000 of voluntary term life insurance, and that is paid primarily by the employee. Well, only by the employee. It's employee paid only, and they can get $120,000, no medical questions asked. And this voluntary term life policy allows members to purchase up to $500,000 as long as it doesn't exceed 10 times the annual salary. They can purchase spousal coverage. Guaranteed issue is $25,000, and for children, it could be either $5,000 or $10,000 face value. and the children can be added up to the age of 26 on all of the plans, medical, dental, including voluntary term life. And let me see, important to add employees after waiting period. Yeah, definitely. Very, very important to always keep in mind that the clock starts ticking as soon as they are eligible. All right, EAP, Employee Assistance Program. So this is provided through TELUS Health, and if you decide to offer it to your employees, it's an 100% employer sponsored plan, meaning the employee does not contribute any portion of the premium, and is a household benefit. Not only is it good for the employee, but anybody who lives in the employee's home, whether it be an aunt, an uncle, a relative, a next door neighbor who's staying at their home for whatever reason. It's a household benefit for issues with personal wellness, with anything life throws at you. If the person moves into a new area, they want to know what the schools are like in the area. They can call and they connect them to people who can help. If you have elderly care issues, you call, they give you the resources. There's counseling, face to face or virtual, 6 sessions per incident. There's identity theft assistance, to referral options, all kinds of anything life throws at you. Anybody in your home can call and get assistance for that particular need. That's what the EAP program is all about. All right. Is this yours, Heather?
You can review that.
Okay.
I should have asked you what the max was this year for the FSA.
Yeah, so the maximum is 3,050, if I recall correctly. Yeah, there it is.
Okay.
Oh, there it is. So yeah, the FSA Flexible Spending Account, it's a really good program. If you have not considered it, maybe you want to waltz with this idea. And it's basically pre-tax dollars employees allocate to this program. And they can do the maximum, or they can do a minimum of 500 or less. And it's just dollars that can be used for any healthcare from head to toe, whether it's counseling, whether it's vision, whether it's medical, whether it's prescription. Definitely you can have, you're going to pay for these copays or this out-of-pocket expenses for these services. Why not do it with pre-tax dollars? So if you have not considered that, give it a good thought. Task is the carrier we use. They're really high tech and very easy application process. You as the employer decide whether some people are concerned, well, what happens if you with the money that is not used? Well, the nice thing is that there's a threshold that you can leave on the account that can roll over to the next year. And at 500, oh dear, I didn't get those numbers, but the amount for this year is 500. I'll have to send the information to Heather so she can share with you. Actually, we have a flyer that has that information. But there's an amount of dollars that you can leave on the account unused, and it rolls over into the next year. But it's a really good resource to use. So take advantage of that. Consider, if you haven't already, to allow your employees to participate on this flexible spending program. They get an ATM card. It looks like an ATM card, and they swipe it every time they go and seek services. Like I mentioned, dental, vision, medical, chiropractic. They can pay with pre-tax dollars. So think about it.
Oops. Okay, so if you haven't already signed up for the PBID portal, which I know a lot of people have, it's very helpful. It's very easy to navigate. You can find your yearbook on there and any kind of forms and documents that you'll need if somebody's terming or adding, or you need to change a beneficiary. Again, you can always come to me for that information. You can actually take employees off, put them on. You can complete your participation agreement online as well. If you need any help, I'll be happy to help you. Like I said, this website is so easy to navigate. It was really made for the average person, which I think is great. So that this is I guess if you want to talk a little bit, Evie, about the late fees and stuff, since I don't really do too much of that stuff.
Sure. So you always wanna stay away from the late fees. You wanna pay your bill. You can do it between the 1st and the 15th. Once you have a balance carry over, then that's where the late fee is accrued. So you want to make sure that you avoid that. We have it in the event you're not aware of. We can also set up your account for recurring payment. You can choose anywhere between the 1st and the 15th, and we can set that up for you. But yeah, the late fee is something accrues only when there is a balance that is forwarded from one bill to another. So as much as possible, definitely stay away from that. And if you're interested, if you're not interested on the recurring payment setup, you can also go online and make your payment online. So yeah, we have the resources for that. You can do that via the portal. If you're currently registered on the portal, you have the feature to go online and make the payment there. And that's the story with the late fee. That's that we call it el cucuy. So you want to make sure that you stay current so that that's never an issue.
So, well, probably a lot of you have seen the participation agreement, which we need back regardless, if you're staying or not going. If you want to make changes for 12/1, we need this back by 11/15. What I've noticed a lot of times is that people will not put the hours in and how many full-time employees. So if you could be mindful of that, and then the billing method as well. And then also what's important is the waiting period for future hires, 30 days, 60 days, or no waiting periods. That's 60 days is the max. And then also fill out the employer contribution, which most of the time is 50% for the employee. Same thing for the dental vision. And sometimes people do like a flat amount. They may say, I'm just going to do a flat amount of, I don't know, $350, and that will encompass everything. So there's a column for that as well. Make sure everything is signed. There is a page in between where it talks, what I've seen a lot last couple of years is if you want us to keep the same plan, there's little check boxes. You just don't check the box. It'll say like term next to it. So unless you want to term the plan, if you want to keep everything the same, all you need to do is complete the top half and sign it. And again, for December 1st, we need them back by 11/15. For January 1st, we need them back by 12/15. Has that changed at all, Evie, or is that the same?
No, that's still the same. And I'm glad that you mentioned that page that we didn't include it on this presentation, right, with the plans?
I thought it
okay.
was on there,
All
but
right,
yeah.
no worries. So when you see your, for those of you who have already downloaded your yearbook, you will see on the section where the plans are that whatever plans you currently offer, they're going to be highlighted in yellow. And then the little box will say term. If you are going to keep those plans, you don't need to check that box. You only check that box if you're going to end that plan because you're electing another. So anything highlighted in yellow under the plan section is what you currently offer. If you're going to keep it, don't check the box. And then the other portion of that participation agreement I wanted to call your attention on is the annual sales gross dollars. It's good that you complete that as well, because then that determines if your association dues need to be adjusted as well.
Yeah, so like I said before, if you signed up for the portal, you can do the participation agreement online, which is super easy. You can email me, assuming I'll be in the office. Otherwise, I don't have any plans to not be in the office, but just in case, it'd probably be best to email it to the PBIT at pbit.org. Or like I said, you could also send it to me or do it online. I don't think anybody's really mailing them or anything like that. So those are the three ways to get the participation agreement over. This is just a brief summary. I've been doing this, I think this is my 3rd year now. So anybody who wants to set up a meeting with me or just give me a call, I'm happy to review everything more in detail, because a lot of people will have already been with us and they, know that they're going to stay with their current plans. And then we also have some people that are just, starting to look at us and need a little bit more attention. But again, I'm here to help you with anything that you may need. If you want to look at health insurance plans outside PBIT, we have Cigna, which is the open access. If anybody's familiar with Cigna, there's a local access, which isn't as good, especially if you have employees around the United States. So this was just going to quote the open access. We also have United Healthcare and Anthem. As far as dental and vision, we have a lot of options, either voluntary, employer paid. If it's something that voluntary, we don't do. We don't do voluntary with the trust. So if you want to do a voluntary plan, which would be 100% paid by the employee, we have that through Humana, and we also have that through Emeritus and Guardian and Principal. We also are partners with AFLAC, and again, these are voluntary plans, 100% and paid by the employee. I believe he just has to have 3 employees that enroll. He has an array of different plans. We have a short-term disability, critical illness. We have a cancer product, accident, all very reasonable, and again, paid by the employee. And if you're interested, we work with Phil White. He's very knowledgeable. He can come out to you or do a phone call. Usually he likes to come out to see the client. If anybody's interested, just let me know, or you can call Phil up directly. We also do PNC, property and casualty. We do business owners policies, workers' comp, auto, crime. We also do a little bit of personal lines insurance, and we have a Medicare that we work with another company for, and also individual life. If you're interested in that, you would go through AFLAC. They do a whole life product. And we also work with Joe with Printers 401k. If anybody doesn't already have a 401k set up that's interested, his information is here in the corner. He works for Diversified Financial, and they can get you all set up with that. We also have a long-term disability and short-term disability plan. We work with Printers Disability Trust. If you're interested in getting a quote, I'll send you the census. We need a salary, dates of birth, that sort of thing, and then I can send you over the plans. 100% employee paid if anybody's interested, and I believe that goes down to 2 people for the through the Printers Disability Trust. Does anybody have any questions? Oh, I see there's a few chats. I'll open that up right now.
There was another one about the yearbooks.
Yeah.
Are they currently available in the portal? And then second part is, are there hard copies being mailed as well?
Yes, the answer is yes. They're currently available on the portal for download, and the copies will be sending out very, let me see here, it's scheduled to be arriving middle of this month. But yeah, hard copies will be in the mail as well.
Yeah, and then one of the questions was about a PPO. The beauty of a PPO is that you can go in and out of network, so that hasn't changed at all. There could be some balance billing. I don't know. Evie, do you want to elaborate on the balance billing? No.
Yeah, the commercial, if we're talking about the Freedom, it behaves like I mentioned, just like a commercial PPO. Now with the Freedom, there is no out of network, just every provider gets paid the same based on the benefit that you're on. So yeah, that is the beauty about the PPO, that you pretty much can go wherever you want. And the provider just submits the claim to the I Imagine 360 to get paid accordingly.
Yeah, and this what the dental PPO as well. If you're not sure if your dentist is in a network, you can either contact me or go online. I can give you the websites to look it up. That's where there may be some balance billing with dental.
Sorry, we're talking about dental. Okay, so one thing
Yeah.
to keep in mind.
Well, I was originally talking about medical, but then I realized I should probably talk about dental as well.
The one thing to keep in mind with dental, everyone, is that when you do have the flexibility of going out of network, but keep in mind also that also exposes your pocket to more expense. So the dentist, if the dentist is not in the network, they don't have to take the payment from the insurance as payment in full, so they can balance bill you. So that, just be prepared for that if you go out of network. As much as possible, stay in the network, because that's better out of your pocket, as well as the doctor is obligated to take the payment as payment in full, and you're only responsible for your portion.
Jenny, were there any other questions?
That's it for now, unless anybody else has any, go ahead and drop them in the chat and we will address them.
And as far as while we do that, task, the amount that maximum carryover from 2024 to 2025 is $640. So that is what you can roll over unused dollars. And the maximum contribution is $3,200. You can make it less, but no more than $3,200. There's
Okay.
also dependent care. If you as the employer decide to not only do medical, but also include daycare, the maximum contribution for daycare is $5,000 for married couples, or $25,000 for each individual on an FSA.
Does anybody have any questions about the migration and how those plans work? Also there's just a few changes to the PPO plans. Anybody have any questions about participation agreement? And guess it's probably about it.
One of the
Wait.
things I wanted to mention, pardon me, Heather, in regards to the Kaiser new plan that was added, if you notice, at the very end, it has the initials VC. And if you go there, yeah, it
Yeah,
stands for virtual care. So the nice thing about that plan is that virtual care is free of charge. So that's a good thing to keep in mind. So there's a separate flyer that we have for that. If you care to have one, just let us know. We'll be more than happy to send it over to you. So that is for that Kaiser new plan, the new one that is
Oh, this
there.
one
You
here?
go right there. VC.
Mhm.
You see that VC at the end? That's what that stands for, virtual care. So virtual care is pretty much free of charge. So that first 3 visits issue does not apply. It's just
If they
whenever
do
need.
virtual.
Yep.
Okay.
Yep.
Okay. Okay.
We had another question. You referenced commercial PPO several times. Can you explain what that is?
So it just behaves like any PPO that is, whether it be like with a Blue Shield or an Anthem, and that's what I meant by commercial, that it's a plan that is provided by an employer to an employee. So it's an employer-sponsored plan. That's what I meant by that.
And someone said when they click on the yearbook in their portal, it says that the file does not exist. What should they do?
So send us an email, because you may have perhaps a plan that's custom, that is part of your menu. That's probably the reason why it may not allow you. Just send me an email, or Heather, and we'll get you a copy.
Yeah, we have a handful of groups that have custom rates.
Yes.
That
So
will be-
those will not be available. If you happen to have a custom plan outside of the trust within your menu, your yearbook is not going to be available, but you can just send us an email and we'll be happy to email you a copy.
Any other questions? Well, I guess we'll wrap it up, and my email is heather@piag.org. If you have any questions, it's also on the email that Jenny sent out. Also, my cell phone number, if you want to set up a call to go review anything, we can do that. Or just give me a call and I'll call you back if I'm not available. So I think that's it. Evie, do you have anything else?
No, thank you very much for allowing us to bring this presentation to you. And also my email address, if you have any other questions that you're too shy to ask now, it's Evie, E-V as Victory, I-E, at PIBT.org. Thank you so much for your time.
Thank you, everyone.